this is by far the largest environmental and food factor that increases the risk of colorectal cancer. And we're also seeing that it increases the risk of like inflammatory bowel diseases like ulcerative colitis, Crohn's disease, diverticulitis.
I'm your host, Ariana, and this is Hot Girls Have. Hello, and welcome back to Hot Girls Have. Have you ever wondered if you should get a colonoscopy because of rising rates of colon cancer? Are bidets actually better for you? As a young person, how can you prevent colon cancer? Today, I'm talking to Dr. Karen Zaghiyan, one of the top board-certified colorectal surgeons in Los Angeles. We'll be talking about supplements you should be taking, how young people are not immune to colon cancer, and why you shouldn't sit on the toilet for more than 5 minutes. Welcome.
Thank you. Thank you for having me.
Awesome. So glad to have you. Okay, let's just dive right in. Colorectal health is so critical to our well-being as humans. It's awkward, it's stigmatized. Will you just give us a brief overview of what it encompasses?
Sure. So believe it or not, colorectal health is more important than just your colorectal health. It's actually with learning about the microbiome and gut immunity and all that stuff. We're learning that your colon may be responsible for diseases beyond your colon health. You know, they're finding things like Parkinson's disease and Alzheimer's disease and diabetes and all sorts of things that are linked to our gut and our gut microbiome. When I tell patients that the colon is the most important organ, I'm not kidding. Right? Colon health or gut health really implies good bacterial health in your colon, having good healthy bowel movements, lack of constipation, diarrhea, inflammation, and then making sure that you're on top of your cancer screening.
When should that be happening?
So for average risk individuals, the current guideline says 45.
Okay.
So if you have no symptoms, no family history, you're just a regular guy or gal walking around life and you hit 45, it's time to get a colonoscopy. So that's my cohort. I turned 45 this year.
Okay.
I've already had a couple colonoscopies but all of my friends are calling me up to get theirs.
Saying, let's go get one together.
Let's go get one.
Okay.
But if you're younger, see, the thing that I think gets lost in translation is that, you know, not only is your family history of colorectal cancers that's important, your family history of colon polyps is important. So if your, parents have had colon polyps, that's not something they walk around advertising because we downplay it, right? As doctors, we come out of a colonoscopy, we tell our patients that they're doing great and we found a little polyp and we removed it and it's nothing to worry about. And it's benign and they go on their lives and they may do their surveillance colonoscopies like recommended, but they don't necessarily come and share that information with their kids.
Right.
So now you're, in your 20s and maybe your mom had a colon polyp that was precancerous when she was 40. That reduces the age at which you should have your first colonoscopy. So do symptoms. A lot of people, think that bleeding is normal, that it's just hemorrhoids. And, sometimes they ask their docs and their docs tell them, oh, don't worry about it. It's just hemorrhoids. And it's possible that at that time it was hemorrhoids and the symptoms have persisted and now something's changed and maybe something else is going on. So it's always important to kind of keep your gut in check, make sure that you are aware of your symptoms, you know your body, you know what's normal and not normal for you. And if there's a change, to bring that to, your doctor's attention so they can get you in for testing.
What are some of the top common colorectal conditions that listeners should be aware of? And what are some of their causes?
The most common colorectal condition is hemorrhoids. Hemorrhoids are so common. 40% of the population is affected by them, believe it or not. So 40% of people walking around at some point in their lives will have a hemorrhoid flare. But remember, hemorrhoids are, you were born with hemorrhoids. Babies have hemorrhoids. So they're just the normal veins around the anus that can flare, and we call it a hemorrhoid when it's flaring, but in fact, it's just normal anatomy. So that's common for people to get problems caused by the hemorrhoids.
Mm-hmm.
So hemorrhoids are super common. The other one that's very common and rising in young individuals is diverticulitis.
Okay.
So diverticulitis is an inflammatory condition of the colon that we used to think it's, there are pockets in the colon that form kind of out of pressure or like weakening of the colon wall. We used to think it was caused by pressure and like nuts and seeds getting stuck inside these pockets.
Right.
But now we're thinking it may actually play a role that is related to your gut immunity and the microbiome and, the different Western diets that we're consuming that's increasing the risk of basically all inflammatory conditions and cancers of the colon.
Mm-hmm. Okay, wait. So I want to get into how colon cancer rates are on the rise for younger patients. From what I've read, this seems to be largely due to diet, exercise, gut health, just like what you said. And I actually read somewhere that it doesn't have anything to do with genetics. Like rates that are rising don't have anything to do with family history. It has to do with a lot more things that maybe are preventable.
Yeah.
Could you speak to that?
Yeah, so only 5 to 10% of colorectal cancer has a genetic predisposition. That means you have a gene that's passed on from one family member to the other that significantly increases your risk of colorectal cancer. While we always look into family history and we take that into consideration when we're talking to people and, when we screen and things like that, for most people, even if they have a family history of colorectal cancer, they don't necessarily have a genetic like a gene that's increasing their risk of colorectal cancer.
Mm-hmm.
Most people get colorectal cancer sporadically, meaning, we don't know why they get it, and we don't know why they get it when they're older, and we don't know why it's rising in young people. We think it's related to something in the Western lifestyle, right? Whether it's our diets or lack of exercise or whatever it is in our environment that is increasing this risk, it's not exactly understood right now. There's some theories, but it's not exactly understood.
So is there anything that young people can do right now, today, to really reduce their risk?
Yeah. So, I think the biggest thing that we have identified at this time that has been linked with colorectal cancer that is something you can actually intervene on or change is processed foods, and specifically processed meats. So those are deli meats, bacon.
I was going to say
pepperoni.
Bacon.
I know. I love them.
Bacon.
And
so does that mean turkey bacon too? Like all bacon?
All bacon.
Okay.
Any meat that's not freshly cooked.
Okay.
So not freshly roasted, not freshly grilled. That sits in a shelf or in packaging.
Okay.
Is processed meat. And this is by far the largest environmental and food factor that increases the risk of colorectal cancer. And we're also seeing that it increases the risk of inflammatory bowel diseases like ulcerative colitis, Crohn's disease, diverticulitis. Overall, gut health is really messed up by eating these processed meats. So that's one.
Okay.
The second is red meat, a little bit of a lower incidence, but specifically charred red meat. So if it's burned over a flame, that charring of the red meat actually creates a carcinogen that increases the risk of cancer. Mm-hmm. Now, it's hard to say don't eat this stuff at all.
Right.
But if you can minimize it, that's best.
Moderation.
Yeah.
Of course. Okay. So those two.
Okay. And then obviously all the other stuff, right? Exercise, don't smoke. Mm-hmm. Minimize your alcohol intake.
All the things we all already know.
All the good stuff.
That a lot of people
The only
still don't
one
follow.
that hasn't been taken away from us as of yet is coffee.
Okay,
you can have your coffee.
You can have coffee.
You can have your coffee.
Okay.
It's still good for you.
Love that.
Yeah.
I'd love to hear your thoughts on some of the products that are out there right now that are supposed to be really great for your gut microbiome. So I know athletic greens is a big one. People are taking these greens powders to help increase their microbiome. I don't even know, increase something in their microbiome.
Diversity.
The diversity in the microbiome.
So we know that microbial diversity in your gut promotes good gut health. Mm-hmm. So that means the number of gut bacteria is higher in healthier individuals.
Right.
Whereas people who have disease, cancer, IBD, inflammatory bowel disease, they have reduced gut microbial diversity. So specifically a product, there's nothing that I can specifically endorse, right? So, and say, yeah, this one thing is really good. The best way to do that is to eat a balanced diet that is full of fiber. So, fiber is fruits, nuts, seeds, veggies, oats. So, all of these are fiber rich foods, and you want to eat a variety of them. So you don't want to have like the same oatmeal for breakfast every morning. You want to kind of like vary it up. Do berries one day, do kiwi, do, spinach with your salad, like do all the different types of these types of foods and add that consistently into your diet. So there's a couple of situations I tell people to take a probiotic in. The one patient population it's actually been studied in, like an actual supplement of a probiotic, is patients with inflammatory bowel disease who've had their colon removed and have a J pouch. These are UC, ulcerative colitis patients where their entire colon has been removed. They have a J pouch, which is constructed of their small intestine, and they can get pouchitis, which is inflammation in their pouch. And a probiotic, actually, a probiotic supplement specifically reduces the chance of this type of inflammation. So that's the one patient population where I say, like, yeah, take it because there's data to support taking it. Everybody else get it through food. There's no benefit to like taking an extra supplement because remember, like when you take a probiotic, again, it's like 1 or 2 strains of bacteria. You're trying to create diversity in your gut, right? So taking like, a supplement with like a couple of strains of bacteria, it may help a little bit, but it's probably not as good as getting it from food.
So what are some of your favorite foods to get your probiotics from?
All the fibers that I mentioned, and then anything that's a fermented food.
I was going to say, are you a sauerkraut, kimchi?
I've recently grown to love them. So like the kefir, sauerkraut, kimchi. I'm not a big kombucha drinker. I think
I like kombucha, but kombucha has so much sugar in it nowadays where I'm like,
that's the problem with it. Like if you want to have like a soda and it tastes good to you and, you're like, sure, I'll get some probiotic with it. You can have that. But I don't really recommend most kombucha drinks, if they taste right, are going to be full of sugar.
Exactly. Yeah. And I feel like that's just counterintuitive.
Exactly.
Okay. That makes sense.
Yeah.
Interesting. What kinds of things are you seeing in some of your older patients that you think is really preventable? Had they just taken action when they were a little bit younger?
Cancer. Oh. So it's unfortunate, right? Because we have like the young generation who's like begging to have access to screening. And then we have our older patients who, for whatever reason, either missed it or weren't recommended or decided they didn't need it because they were feeling healthy otherwise. So they didn't get their colonoscopies. So, we all have parents. Talk to your parents and make sure that they are on top of their colonoscopies because colorectal cancer in the screenable patient population is preventable.
Wow. How preventable?
It's absolutely preventable. If you're by colonoscopy screening, we remove the polyps, and these are precancerous polyps. So we're not letting the cancers form. It's different than like breast cancer or pancreatic cancer or like any other type of cancer for which we have screening tests, but they're not preventative tests, right? So if you get a mammogram for breast cancer screening, you may detect the breast cancer early, but you're not going to actually find a precancerous lesion that you can do something about to prevent yourself from getting a breast cancer. Right. With colorectal cancer, we can actually prevent colorectal cancer for patients that can be screened. So if you can have a colonoscopy and we find polyps during your colonoscopy and we remove those polyps, we're not letting the cancer actually form. So that's why I'm a huge advocate for specifically colonoscopy screening as well, because there's 7 different ways you can screen for colorectal cancer. They're all acceptable. I tell people that any screening is better than no screening, but specifically like the stool-based tests, some of these have become really popular in recent years, and some health systems as well as like European countries don't use colonoscopy because there's lack of access to enough interventionalists who can do the colonoscopy, so people don't have access. So they use stool-based tests, which are, again, they're better than nothing, but the problem with them is that they're good at finding cancers, they're not good at finding precancerous polyps.
I see.
So you can't prevent it, right?
Mhm.
You can detect it early still with stool-based screening,
Mhm.
but it's less likely that you prevent a cancer with stool-based screening, whereas you can prevent it with colonoscopy.
Mhm. Okay, I'll get personal with you for a second. So last year, I actually had to get a colonoscopy and an upper and lower endoscopy.
Okay.
Totally unrelated to why somebody would actually just get a
Mm-hmm.
colonoscopy. I had some other health situation going on, but my doctor wanted me to get one just in case.
Mm-hmm.
We did find a polyp that was like precancerous. It was kind of like a just in case, we're going to get rid of this.
Yeah.
And I'd love to hear your thoughts on that, like, just in case kind of screening situation. I didn't need to get a colonoscopy.
Yeah.
I'm 24 years old.
Yeah.
Last year I was 23. I was the youngest one at the center by so many years, getting this done. Could you speak to if there's anybody listening that might have certain symptoms or have something else going on where you might suggest they should get a colonoscopy just in case as well?
Yeah. Just in case testing is tough. I actually just posted about this on my social media.
I saw. I'm a big fan.
Specifically about CT, just in case testing. But it applies to colonoscopy, obviously, as well, right? And I think, if we're going to compare a CT versus colonoscopy, let's just get a test just to get a test. I feel like colonoscopy is actually better than CT because colon polyps and cancers don't develop like that fast.
Right.
So it takes like decades to get a colon cancer. So if you're 24 and you have a colonoscopy and they find a preventable polyp, right, that may have turned into a cancer by the time you were 45 and of screening age. Absolutely, there's no question. So the fact that you had that and that it's a save, right? Any change in anything, and any change in your gut that you're not getting an answer to, right? So the problem is that IBS, irritable bowel, is so common. And almost everyone has some component of IBS, right? And the problem is that colon cancer symptoms are the exact symptoms of IBS, which makes it so difficult, right? How do you tell somebody when they have new onset symptoms that it's just IBS? We have a couple of tests to diagnose IBS now, but what if you do that and it's negative, right? Then if your symptoms are things that have been stably abnormal for a decade plus, that's probably not colon cancer, right? But if you used to go to the bathroom number 2 once a day, and all of a sudden for the past 6 months you've been going 4 times a day, right? Or your stools have changed, that's a red flag. So if you have that, then, you got to talk to your docs and advocate for yourselves, because I think that's where a lot of young people kind of get trapped, is they, because young people are assumed to not be individuals that can get cancers. And this is, I think, changing across the health system. I think doctors in general are becoming better at navigating, the young onset cancers, world, and paying attention to younger individuals. But I think before, and especially in certain settings, it's blown off. Any symptom, if you're young, is blown off. Don't worry about it. It's just nerves. Don't worry about it. It's just irritable bowel. Right. Don't worry about it. It's just hemorrhoids. Hemorrhoids being diagnosed without even exam.
That's so interesting. I feel like a huge takeaway from this conversation so far has been that, one, it's really important to advocate for yourself and be really in tune with your body and just be aware of changes. Yeah. And 2, that IBS might not be IBS. IBS might actually be colon cancer, and you need to get that checked out.
Yeah. If you have new IBS, get that checked out. Don't just assume it's IBS.
Okay, next I want to talk about 2 things that you've openly said that you would never do as a colorectal surgeon. So 1, you would never use wet wipes. And 2, you would never sit more than 5 minutes on the toilet. These are 2 things that I feel like
they're bold.
Everybody does. So tell me, you would never do either of these things.
So I was trying to be bold, obviously, when I said that, right? I probably have spent more than 5 minutes on the toilet at some point in my life. But it's just such a huge factor in development of hemorrhoids, right? And I've had to, nobody taught me this. I've just learned over time with taking care of patients. We all get caught up in our emails and all of a sudden you've completed your bowel movement, but you find yourself sitting there an extra 10 minutes, like
an extra 10. I could speak to my boyfriend right now and say like an extra 30. Like I feel like everybody just gets sidetracked.
It's like it's me time.
Yes,
it's me time. The only people that don't, you don't have kids, but I have 2 girls, and only moms don't get me time.
Right.
It's the only time where you're like alone. No one's gonna disturb you. No one's gonna bother you, and then you get caught up. So you have to not do that. Now, obviously, I'm not talking to the folks that have like massive, like if you have food poisoning, you have like massive diarrhea.
Take your time.
You're like, yeah, it's okay. I'm just talking about like on a regular basis, just sitting there every morning, or like the idea that like I have to have a bowel movement right now, and I'm going to spend like half an hour here until it happens. If even if your bowel movement gets cut off halfway, and like all of a sudden you're like, shit, there's still something left, you can get up and come back, like if it's not happening.
So why should you not sit on the toilet?
It's a vacuum. So the toilet is a vacuum. It's an empty space, and it sucks your bottom in, and over time and time on the toilet, and just like repeated encounters like that, what happens is the veins swell and they engorge. Veins are low pressure, it's a low pressure system, the hemorrhoidal veins. So the blood will pool where the pressure is low, and the pressure is high going down onto the hemorrhoids and low into the toilet. So it's different than like, that people are like, why can't, what's different than me sitting on my sofa? The difference is that the sofa has counter pressure.
I'm not comparing the toilet to a sofa.
Yeah.
Okay. Fair.
So that's number one.
Sense. Yes. And then number 2 is
wet wipes.
Wet wipes.
Yeah. So this is another thing. Like, yes, I've used a wet wipe in my life. Yes, I've used wet wipes on my kids, but regular use of wet wipes, and it's not that it's going to happen to everybody. People say, well, I use it and I love it, and I've been doing this for 20 years and I haven't had any issues. Sure, go on your way, no worries. But I see so many individuals come into my practice with awful dermatitis, red, thinned out, dried out skin that is related to the wet wipes. You cut the wet wipes, you get them on some diaper rash cream and get them to just wash their butts, and it goes away.
Wow.
So, and
so an alternative to the wet wipes, I've heard, is
bidet.
A bidet.
So bidets have become kind of vogue in the U.S. lately, because we have like the ones that attach onto your toilet. And one of my patients turned me on to this years ago. And then I got one, and then I upgraded ours when we remodeled our bathroom.
Now it's like a fun
thing. And I'm a huge fan.
I've never tried one, I won't lie, but I can understand why they would be better than wet wipes in terms of like hygiene, cleanliness, all of the above.
They're better.
Okay.
I mean, they're better. You got to try it to know it.
Okay. Once you try a bidet, you'll never go back.
You'll never go back. And yeah, like my kids would not let me install it in their toilet because they were scared of it.
Really?
Because they were scared of the water like splashing at them like that. Yeah. And we recently went on vacation somewhere that had it. And so they were like, oh, I guess I'll try it. And now they're like, can we get a bidet?
And you're like, I told you so.
Exactly.
That's amazing. Okay, tell me about some supplements that we should all be taking or avoiding.
I mean, the only supplement I would advocate for gut health is a fiber supplement if you can't get it again in your diet. So just plain old psyllium husk. That's
basic, easy.
Just basic and easy.
I know that you've spoken. I bring this up because I know that you have spoken at length about specific herbal remedies.
Oh yeah,
and how we should not using those.
Yeah. So anything that has a stimulant in it is not the best for your gut. So, and the reason it's not the best for your gut is a stimulant laxative. So like aloe is a stimulant laxative. Senna is a stimulant laxative. Chinese herbs and teas, laxative teas, have stimulant laxatives. They're herbal, but they're laxatives. So what happens is over time, they work great, but over time, your body becomes dependent on it, meaning you need more and more and more, and it eventually doesn't work. And then when it doesn't work, now you need stronger stuff, or you need, prescription medications. So ideally, not taking those is best if you don't have to have. You occasionally have like a massive bout of constipation and you just want to take something once to just like clean yourself out. It's fine. Do what you got to do.
Right.
But on a regular basis, I'd prefer you do dietary fiber, so through food, getting 25 to 35 grams a day of dietary fiber intake through all the different foods that I mentioned that are good is ideal. Drinking a lot of water to make sure that the fiber works and that it sucks up the water and it propels through your intestines. If you have to do something like a stool softener, Miralax is a good one. Miralax gotten a bad rap lately.
Yes, I've seen that. There's a whole thing going on.
There's a whole thing going on about Miralax,
Miralax.
but it's if you have to take something and the diet, the food stuff is not working, Miralax is fine to take. It's fine to take in kids. It's not a stimulant. The other one you could do is magnesium. So people like taking magnesium at night. It helps with sleep. It's also good for your colon health. Okay. What else? Probiotics, not really, unless like a specific situation where you've taken an antibiotic and you just want to beef things back up, but you can do that with diet as well. Those are the main ones.
I did see there's this statistic that says that colon cancer is the #1 leading cause of death in men and #2 in women, just behind breast cancer nowadays.
In men under 50.
Yes, and under 50.
So the American Cancer Society recently published their 2024 report. They produce an annual report every January, and they look at cancer statistics. And shockingly, we've seen cancers rising in younger individuals, but seeing that statistic that among men younger than 50, colorectal cancer is the #1 leading cause of cancer-related death is crazy.
That's terrifying.
It's so terrifying. And specifically, we're seeing rectal cancer.
Oh, interesting.
Specifically, there's a rise across all colorectal cancer, but specifically rectal cancer, for whatever reason, is really rising among younger individuals and younger men.
Do we have any idea why?
Same stuff. We have no idea why. We think it's something related to the environment with our diets. Lifestyle, yeah.
Tell me about some non-invasive treatments.
We can treat hemorrhoids, and it's easier to treat them non-invasively when they're early. So people always assume that that if you go see a colorectal surgeon, that we're going to do surgery on you. And obviously, for obvious reasons, people avoid coming in to see us, right? As far as hemorrhoids go, early hemorrhoids, meaning the lower grade hemorrhoids, we can actually treat very effectively in the office. And even some later stage hemorrhoids, we can do serial treatments on to get those controlled in the office. A very small minority of my patients ultimately have surgery for hemorrhoids. I think for the younger generations, and I'm seeing this in my practice as well, I think younger people are just more attuned to their health and their bodies and come in for things that I think the older folks are a little bit like, an older patient may tolerate a hemorrhoid a lot longer and let it go a lot more before they seek treatment.
Right.
Whereas I think the younger generations are just coming in at any early sign of anything, which I love.
We're all paranoid about our health.
Well, I don't think it's paranoia. I think it's, I think everything is shifted. Like when you look at skincare,
Right.
And,
so true.
All the things that
I feel like right now, me personally being part of that generation, I'm 24. I'm very, very aware that there's so many ways to prevent a lot of things now.
Absolutely.
And I want to
I want to
take care of myself.
You want to do it. Yeah. Why would you let your hemorrhoids get to the point that they're, surgical,
right,
when we could do something about them when, you have early manifestations on them? And then second is maintenance, right? People sometimes come in and they get 1 or 2 treatments and they assume it didn't help or it didn't work. So they just assume that's it. It's a lost cause and surgery's next. And then they avoid coming in for a long time. And then they come in and it's really, really bad. And we either have to take multiple steps and multiple treatments to get them back on track, or it is surgical. So I think just knowing that, there's non-invasive things we can do for almost every condition. Avoidance is not going to help. And, it's good to be, a little paranoia is actually
Right,
good.
right.
And, be in tune with your body and come in and, and advocate for yourself. Again, I think we keep saying that.
We love ending every episode with one key takeaway that listeners can drop in their group chats. What is yours?
Take care of your butt.
I love that so much. Oh my God.
You caught me off guard with that one. I had to come up with some weird shit,
Karen, thank you so much for being here. This
you're
was
welcome.
such a fun conversation.
No worries.
And so knowledgeable. Oh my gosh, this is awesome.
It's good. It's crazy, huh? How much a colorectal surgeon actually knows.
Seriously.
I surprise myself sometimes. I'm like, shit, I know all that?
I love it. All right,
awesome.
thank you again.
Thank you for having me.
Thank you so much for joining us on today's episode of Hot Girls Have. You can find anything we mentioned in our show notes. Want more? Visit our website or check out our social media. This podcast is brought to you by Belly Welly, leading the charge in women's gut health.